Thanks so much for the introductions. So today, the focus of the talk will be on anger management and emotional regulation, and specifically reviewing some strategies for care providers. And I'm hoping by the end of the presentation, you have some practical tools to take away to help with your situations. The areas that I will be covering today will include looking at what emotional dysregulation is, understanding when there is a lack of insight or self-awareness into somebody's behavior, when there is a lack of motivation or initiation, and understanding how that impacts somebody's behavior and presentation, specifically looking at disinhibited behavior and the importance of setting boundaries and self-management for oneself, especially as a care provider, and incorporating self-care and making this a non-negotiable within your routine in order to help you with everything that you're managing with your loved one. So I want to begin with taking a closer look at what emotional dysregulation is. So when someone has suffered a traumatic brain injury and that area of the brain has been impacted, oftentimes it can impact people's personality, their mood, and their behavior. So someone can be relatively calm and okay, and all of a sudden these emotions can come forward and their behavior can change. You could see anger outbursts. There could be a lot of anxiety, anxious behaviors. There can be high irritability or low frustration tolerance. Some of the anger can range from sort of ongoing anger or rage, high aggressive behaviors that can be very difficult to manage. There can be impulsivity, and then a flux between all of these different types of emotions can occur. So when you're trying to live with somebody that has the complexity and changes within their emotions and behavior, it becomes something that we have to understand before we know which strategies are going to be most effective. So when we look at the impact of how emotional dysregulation and these behavior changes have on caregivers specifically, we know that oftentimes behaviors by other people are not fully understood after a brain injury. So it can feel very exhausting to deal with day to day. It can be anxiety provoking for yourself. So if there's somebody you're caring for that has a lot of anger or aggression and anxiety, it can even cause you to have some secondary symptoms of that because you're being exposed to it so much. It can be very depressing when you're having to adapt to these changes of someone else's behavior. It can even be anger provoking as well when you're trying to deal with someone and constantly help them calm down or understand a situation, and they either don't have the capacity or the memory, or they're just simply not able to have that control. It can be constantly worrisome for a caregiver, not knowing what to expect or what to predict when they're out in the community or around other people. And it can feel very isolating because it's very, again, like I said, difficult for people to understand. It can be confusing when you're trying to see your loved one recover and understand these behaviors and what to do about them. Feelings of disheartening. It can be disappointing and even embarrassing when the behaviors are very extreme, and especially when they're around other people. So I want to validate these feelings because when they set in, you're certainly not alone. These are very common feelings that caregivers will experience. And despite all of this, it is important as much as possible to focus on the good moments that are in the day and making sure that you find those moments, even when the day is really difficult to manage. So some of the strategies that I wanted to recommend when you're responding to dealing with changes in someone's mood and dysregulation is, first of all, there has to be an understanding that you're not responsible to control someone else's behavior. That would be actually impossible to do so, although there will be some discussion later on co-regulation and how your behavior and calmness can help when someone else becomes dysregulated. It's never the responsibility to calm somebody else down. It's also important to be very mindful of your own response and reactions to different behaviors that you're confronted with, whether it's sadness, anxiety, anger, because your reaction or lack thereof can either impact the person positively or negatively. If somebody is enraged and you verbally try to calm them down or redirect them, it can actually exacerbate the behavior. So it's important to know what is going to work within the context of the situation that you're in. Considering whether a response that you're going to provide should be verbal, and in some cases it can be helpful, and in some cases nonverbal is better, and it's where you can still be validating, but you don't actually have to say anything. Even though it's hard to plan, one thing that most caregivers start to learn is words that can be triggersome. So when words are triggersome, we have to be careful of the word choice that we're using when we're interacting with somebody who's very upset, the tone of our voice, the volume, even our own body language or facial expressions can have an impact on how someone else is perceiving your response to them. So using your own calming strategies throughout the day is very important because this helps you stay grounded and regulated as much as possible. And it avoids the tendency to either react or overreact to situations when they come about. The other thing that's very important, both for the person who's dysregulated as well as for the caregiver, is to ensure that space is provided and time for de-escalation, because the space that you're in together can sometimes make the situation worse. And even if someone requires supervision and you can't go into another room, you can still turn your body away from the situation or just let them know that space is being required for yourself as opposed for them, and that can be helpful. And avoid giving attention to highly negative behaviors. Unfortunately, that can reinforce them to continue. And even if someone's obviously not trying to act in a certain way, it is very important to time the feedback that you give when you're trying to provide some insight or just let someone else know how you've been feeling within the situation. There has to be timing to do that. And it's not when a person is highly upset. One of the areas I think it's very important to understand when we're looking at these behavior changes is that when someone is unaware and they lack the insight or have the self-awareness into the changes within their personality or how their mood can go up and down and the behavior reactiveness that comes about, if someone does not see that, even though you are seeing that and are experiencing it, it's going to look very different for each of you, the caregiver and the one that's going through the recovery. And understanding lack of insight, because sometimes it looks like someone does get what they're doing and it's very intentional behavior. And some of the time it can be, but oftentimes it's not. And some of those contributing factors to lack of insight and self-awareness could be someone's memory and attention. So they're not remembering the context of a situation or even what happened at all when the moment has passed, even though you as the caregiver are. There could be limited or distortion in how they've recalled an event. So sometimes blame can be put forward because of the way they've recalled a situation. And then you're trying to rationalize that that's not quite what happened. And that leads into the perception of a situation. If someone sees something their way, even though that might not in fact be the reality, unfortunately, that perception of their situation becomes that person's reality. Again, it's not the responsibility to change that, but making sure that it's understood helps sometimes your reactions to situation and understanding of the behaviors that you're seeing. People can have very strong rigidities in their thinking after brain injury, making it even more difficult to see other perspectives of the situation or another point of view. There could also be a sense of denial of changes to their behavior. And again, even though someone might gently trying to be pointing out, well, this happens when you're angry, someone could simply say, no, that doesn't. So it can make that dynamic very challenged. And there can also be perseverations in behavior where the person who isn't quite seeing all these changes might become very fixated and perseverative on the caregiver's behavior and what they're doing wrong, as opposed to really being able to see some of the challenges within themselves. And also not having the awareness of the severity, intensity of some of these behaviors have on a caregiver. So the person that's experiencing the high dysregulation, often when they calm down, they can move forward. Some people do have some remorse, or they're really struggling to deal with how they've acted, but other people have absolutely none, and they're able to move on. And that can also be very difficult as a care provider when you're dealing with that. So when we've talked about some of these behavior challenges, both for the caregiver and for the person experiencing it, how do you manage all of this? So I wanted to pull some of the main things that could be helpful. So first and foremost is to consider what is the best response for your loved one. And that can really vary depending on the person, who they are, their personality, and the changes that you're experiencing. Like I said, some people, they want some type of validation and comfort. Other people want to be left alone. Sometimes things have to be put on in the background to provide comfort if they don't want that from the care provider. So it's really understanding what's going to work best. And sometimes that does involve some trial and error to determine what that looks like. When someone is very upset, and just like if we can think about for ourselves, it's never usually a good time to provide that insight building or a rationalization for what's happening, because the emotions are so heightened and are taking over. It really compromises the person's ability to think clearly and really hear and understand and process what someone else is saying. So it's having the right time to do that. And when it comes to managing your own responsiveness and reaction, and I know how difficult this one is trying not to overreact to a situation and try to keep yourself in control to reduce any potential dysregulation that can set in with you. And that might mean, taking a short break, having a glass of water, having some AirPods on you, and just putting some music into your ears so that you're managing a situation. And again, that becomes very individualized for you, what's going to work the best. We talked about timing of feedback. It doesn't have to be right in that situation immediately, and it doesn't even have to be right after the situation. I think that giving feedback and being able to reflect and help someone build in some insight, we have to be mindful of the time that works best for everybody. Also determining the additional supports that might be needed to help someone. I often hear that when a family member or a spouse is trying to provide feedback, the person they're not always as receptive. So it's who is also communicating some of the messages that need to be repeated also have to be factored in. And that's where it means you have to modify your approach. So again, the words that you're using, the tone, just factoring in how best to respond in a situation that's going to help the other person feel better and calm down. And looking at how the person that you're caring for is perceiving the situations that are causing, or they feel that's causing, the dysregulation that sets in. Another area that can contribute to a variety of different mood and behavior that you will see, and it can look often like somebody is being avoidant or lazy or just not wanting to try and put the efforts in. And again, a small percentage of the time that could be the case, but there's always reasons behind that. And it's very important to carefully understand what those reasons are. When we specifically are looking at a lack of motivation or initiation to do something. So it could be within the routine, or I've often been told, my loved one is not doing enough to try to manage their behavior or not incorporating enough strategies. It's not so easy to do when we're trying to manage and moderate ourselves and have the control and present ourselves to the best self that we can. So lack of motivation initiation is something that occurs when there has been injury to the brain. It's not so easy to either have the motivation or start doing something, that even if you want to do it. And some of those factors behind it could be low mood. If the person's feeling very discouraged and they want to avoid situations that they know are going to continue to cause them to react in a negative manner. If there's high anxiety, that can also be a contributing factor, preventing someone from feeling motivated or being able to initiate a task that's they're supposed to do or that is going to help them. Chronic pain is another very limiting factor, and it can also be an irritant for people when you're living with that and cause someone to have a lower frustration tolerance. Energy levels can be impacting someone's ability to even have the strength to follow strategies all the time or be able to even commit and follow through with certain things that are going to be helpful. The feelings of being overwhelmed, having lacking confidence because of noticing some of the limitations that they have, and also the efforts that are required to manage not just their recovery and their routines now, but also manage themselves when it comes from a self-regulation perspective. And we all know that that takes a lot of effort, a lot of routine and pacing throughout our day, as well as certain self-care things in order for everyone to operate at their best. So after a brain injury, it becomes significantly compromised and something that has to be understood. Other people can also feel that they don't have much purpose. So the lower our value, our self-worth, our sense of purpose is day to day, it does impact our mood, which in turn is going to significantly impact our behavior and how we can and how we do interact with other people. So ways that everyone can help other people that are going through this process of recovery to stay motivated and to incorporate whatever types of motivation possible. Sometimes it's about setting up, if it's going to be helpful, something that's visual. So it could be on a whiteboard, it could be using somebody's phone. Post-its aren't usually effective enough, but things that have a visual representation, sometimes even having a picture of the family with a message attached to it can help instill some of that motivation and purpose that someone needs. The use of auditory cues. So people can get frustrated when they have a continual series of prompts being given by a person, whether it's their loved one who's also a care provider or another support person. So other systems can be used either through the phone or using a Google Home or Alexa that can be programmed to help cue somebody. It can even be giving affirmations for the day or reminders of gratitude to help focus and shift the mindset. So that really helps setting the tone for the day, because if we're dealing with pain and we're dealing with low mood and limitations and sort of that confusion or lack of sense of self, these things also have to be incorporated into someone's routine to help give that extra push. And that's where a care provider, as much as possible, that provides that validation, small or big validations, so that the person is able to see part of that process that sometimes gets overlooked or minimized becomes invaluable for them. And that helps lead to establishing a new sense of purpose and what my life can look like and how I can incorporate quality into it. So by demonstrating and reinforcing to your loved one, like it's about not accomplishing the big race right away, but taking one step at a time to get to that goal. And there's always ways to get to where you want to be. But when someone feels encouraged and they know that they have all the support around them, it can be much more motivating and prevent them from giving up and keep persevering as they have been. I wanted to also point out another area when it comes to behavior changes that often caregivers report to me that become very difficult to manage. And that's anything under the realm of disinhibited behaviors. And I'll just go into a little bit more explanation of what that looks like. So when there is disinhibition, there is a lack of filter or control over what somebody can say and what somebody can do. So they don't have that sort of forethought. How is that going to impact somebody else or even myself? Nor do they have necessarily the afterthought or consequence of what doing a certain behavior looks like or saying something. And that can be very challenging to live with when you're a care provider and to deal with day in and day out. So just to provide some examples of what that looks like, it could be verbal disinhibition, where somebody is either making a lot of negatory comments or inappropriate dialogue, saying things to other people or other family members or even friends that become very off-putting for the person on the receiving end, but the person doing it doesn't necessarily recognize that there's a problem with what they're saying. This also extends to physical disinhibition, so where there could be high levels of physical aggressiveness, or whether it's to a person or to the environment. Sexual disinhibition is another one that can be very, very common. And again, people can be very embarrassed or to talk about it, but it's something that does need to be discussed because there can be some strategies and supports in place for dealing with that. There can be lots of impulsivity, whether again, it's with someone's actions or words, leading to risk-taking behaviors or other problematic situations that arise. There could be, behaviors that are a little bit more on the extreme end where they're norm violating or even lead to criminal issues and activity. And these changes in personalities make it really hard for somebody that's providing that care and support on how to respond to these different behaviors, how to deal with that. So again, it's important that we understand these are not behaviors that are often intentional, although it can a lot of times look like that. It is a lack of ability to control what is coming out, both verbally and physically. And in order to look at the disinhibition and how do we try to positively shape some of these behaviors in a better way, it is individualized, but there is possible ways, again, to manage some of these very more challenged behaviors to deal with. So some of the strategies when we're looking at disinhibition, what to do about that, is understanding that impulsive behavior can happen anytime. It can be very easily triggered. It can be predictable sometimes or completely unpredictable. But the idea is that when the impulsive behavior comes about, is not to try to control or stop it from happening. It's really trying to make sure that if you're with your loved one, that they're safe and the people around them are, and that you're safe as much as possible. And then trying to redirect to a different area or situation and not directly dealing with any disinhibition right in that moment. And that's also when to know, like, behaviors can be ignored that are unpleasant. So if someone is screaming at you or name calling, constantly pointing out what you're doing wrong, even though you're the one trying to provide that support and care, you don't have to respond to negative behaviors. When we respond to negative behaviors, at times it can exacerbate them. Other times when someone feels ignored, it can also exacerbate behaviors, but we have to look at the best way to deal with it in order to reduce the frequency of it coming out. When aggression is very severe, again, safety both for the person and for yourself is first and foremost, and making sure that a proper protocol is established so that everyone is able to manage that situation as best as they possibly can becomes very high priority. Also talking about the importance of when and how to provide feedback. If a repetitive behavior is occurring and the more you talk about it, the more it occurs, then having that discussion isn't the best strategy. So it's looking at what is another way to be able to shape that behavior more positively. And the other thing that's important as a care provider is that even though you are trying to support these behavior changes, you have to set boundaries for yourself and for the person, because boundary setting is still very important. Although the expectation around behavior change can't be fully paired with that, a boundary setting is important to tolerate and manage the magnitude of what you're dealing with. And we can talk about that a little bit more later on in the presentation. I think it's very important when it comes to the role of the caregiver, as much as possible, is understanding what are all the possible triggers of that individual. Is it sensory based? Is it pain based? Is it depression? Is it anxiety? Is it hearing certain words or seeing certain people? So it's really understanding the combination of contributing factors to what can cause disinhibition, what can cause dysregulation. And it's not trying to set everything up perfectly for someone to manage, but it's just how to learn to adapt and understand why these things are happening. And then it makes it a little more tolerable in managing them. And being so mindful of how your reactions, and that's where co-regulation sets in, is how we ourselves, again, not responsible for calming someone else down or changing someone else's behavior. We only have the control over ourselves. But the calmer we can be, or sometimes not saying anything or modeling something, that has the ability to provide a co-regulation for somebody who is really struggling with regulating in that moment. So sometimes it does mean like, okay, I'm going to change the lighting of this room, or I'm going to incorporate some music. I'm going to hand a glass of ice water to help this person right now. And by doing things like that, remaining calm ourselves, it can really have a positive effect in some cases. When we're looking at the importance of how to set boundaries, this becomes very, very instrumental, because dealing day in and day out with very, very significant behavior changes means it's very wearing and exhausting for you as that care provider, where oftentimes you're trying to do many different roles. You're trying to be a partner or a parent or a spouse, and you're still also trying to provide that care. Even if it's support workers as well that are coming in, it doesn't mean that we have to be taking in all these behaviors that start to impact us. By setting boundaries, it can be, if someone, again, is able to manage it, and it really is going to be paired with the capacity of the person that you're providing support for, is whether you make it clear, if you start to scream at me, that is your right to have that expression come out. I'm going to have to just step out of the room because I can't be an audience for that. And then when we set a boundary, and oftentimes the boundary verbally does have to be repeated if someone's not able to remember what that looks like, but the action then has to be followed through consistently. So we don't want to set boundaries using threatening comments. I'm going to do this if you do this. It's more following through with what you need to do for your own well-being and your own tolerance levels. And it also will help your loved one as well. Again, when to respond and using the best approach. And it's not always you being able to give the direct feedback. If that just causes further escalation, it might be somebody else that's providing that support. So it's just really being mindful of what approach works best and trialing things. If something that you're doing and is not working, is being open to trying something new, because it doesn't hurt just to see what different outcome you can have. And also when not to respond. So it sometimes becomes when there's just like an overwhelming load of challenges that someone's dealing with in a day, is it doesn't always warrant a response. And it might be more of a validation where we say, I understand that you're very upset about the situation. So you're acknowledging and validating, but you're not responding to, let's say, the yelling or the aggression or something else negative that's coming out. You're just giving that simple validation and space for the person when they need it. Space becomes instrumental in time. So everyone's unique and different, and everyone takes different amounts of time to calm back down and regain control. And even yourself, we all have our moments where we need to reset, we need to regroup and be able to have that space to do so. And we can't put a time frame on that. And I know sometimes, depending on the situation where you are, that can be challenging, but it's very important not to have that additional pressure. So again, using strategies for yourself, such as, I have people that use headphones. I have people that have other sensory things on them, just to help them cope and have their own routines to have those mental breaks from the situation. And that helps increase your individual coping ability and threshold to tolerate different things. So that leads into a little more discussion on self-regulation and self-management. So It's important, as we're all human and we all need our own set of tools and strategies. And in order to control your own reactions to the best ability that you can, there has to be the things that what are the things that help calm me down. So whether it means that and not just in the moment that you're dealing with these exacerbations of behavior, but how do you increase your threshold of handling things day to day? So it could be routines such as, making sure there's some fresh air in your day, that there's exercise, there's yoga, there's meditations or mindfulness, that you're trying to eat healthy, trying to get time away so that you can replenish and regroup. So in order to control your reactions more, some of those systems have to be built into your routine. And also reminding yourself that you have to focus on your control, and the only thing and person you're able to control becomes yourself. You can't control the environment or the circumstances or the person around you, and oftentimes we feel a responsibility to do so when we're in a caregiver role, and know that your influence becomes important but not your control over a person or a situation. And again, using those strategies to manage your mood and acknowledging there's going to be times that you can get upset, or there's going to be times you're just completely depleted and exhausted. And what do you need to do to build back up? Who are your support systems? What does that look like? So whether it's family or friend support, or there's groups that you're part of that provide that emotional support, again, making sure that you have, even if it's 10 minutes a day, incorporated, a handful of times in a day, that time has to be built in order to make it better for you to manage your own mood and everything that you have to deal with as a care provider. Some of the things that can also be helpful, not just for the person that experiences the dysregulation, but also for yourself, is having your own grounding techniques to help with regulation. So that could be, having an app that you have to listen to, even if it's for 2 minutes, that helps with either incorporating affirmations or gratitude or meditation. It can be done even for 2 minutes. Sometimes people think it's a big commitment, and it doesn't have to be. If other grounding techniques might be some visuals you have for yourself that you look at throughout the day, or reminders that come on your phone to remind you that you're doing an amazing job, you're doing the best you can, and that you are, on the right path. And it's important that we build ourselves up, that we're filling our own glass every single day, just as you're trying to do within your role for somebody else. Also, the importance of stepping back, taking a pause, having space, and taking those breaks just to kind of breathe and regroup becomes so important. We can often, as care providers, lose ourselves and our sense of self when we're giving so much support and managing everything else for somebody else that's going through a recovery, especially when it's long-standing and many years have passed. Having those breaks and pacing your own routines becomes very important in terms of everything that you're managing. And like I said, that's where some of the self-care becomes, again, so instrumental and should not be minimized or neglected. And when people say to me, which they often do, I don't have time, it's important that we build in the time, even if it, like I said, it's 5 or 10 minutes and it's spaced out throughout the day, because I can understand not everyone's going to have an hour break or a half a day break, depending on their circumstances. I think it's also important to remove blame for yourself when certain behaviors or commentary gets directed at you, that it's your fault I'm acting this way, or you caused me to do this, or you didn't do enough. Whatever that could look like, it is not your fault. I think when that commentary comes out, again, it's because a person can be hurting, they can be very disinhibited. So it doesn't mean that they're really intentional in what they're saying, but they're struggling with their own issues. And it's important not to take that blame and personalize everything that's said to you. And that's where setting expectations become very important. The expectations you have for certain behavior or emotional changes with your loved one that are aligned with their ability and the capacity to make those changes, and really looking at the supports that are needed. I think that change is always possible, no matter how challenged the situation is. But it's really looking at the expectations on a person that's capacity is maybe a little bit more limited. So that means that you yourself accepting that and doing what you need to do in order to still also have your life becomes very important. And trying to regain perspective around understanding, like, why has this happened? Why does this happen to our family? Why has this happened to my loved one? Why is this happening to me? Trying to have the perspective, as difficulty as that can be, and then moving forward and keep looking ahead in order to make sure that the impact of someone else's changes aren't completely depleting you and taking you down as well. And this is where that importance of the self-care and making yourself the priority as well, which you can do both, even though time permitting, it might be a lot less. Those routines, as I discussed before, become so instrumental and important to cope. So even if it means, like, when you wake up in the morning, you cushion in that 5 to 10 minutes of time for yourself, either if it's listening to something or doing deep breathing, doing a mindfulness exercise to really ground yourself to your own strength and resiliency to handle the day and support the person you're caring for is just so very, very valuable and important. When it comes to meditation can be very simple. It doesn't have to be something that's like intense or time committing. It could be sitting there. It could be deep breathing, focusing on gratitude, focusing on yourself, being able to, even now there's so many different types of, like, YouTube channels and apps that provide some of the guided meditations. And until you've kind of tried it, they're so personalized and different. There's usually one that could be appealing for most people and can be very valuable. And that leads into a lot of the gratitude. So, depending on your situation, sometimes it's hard to find, like, how am I going to be grateful for my day or the things around me? But that thought process and mindset of gratitude, and when we are focusing on that, even if it's for a few minutes here and there, becomes invaluable in our own well-being and our mental strength and resiliency. So it is something that not everyone thinks to do, but it becomes a very necessary strategy for all of us. And making sure that your self-care routine, whatever that can look like, is scheduled into your day, just as you've scheduled in your loved one's day of everything they need. You have to be doing the same to increase the probability of you following it. And the more consistent somebody is with using self-care and putting this into their routine, the more benefits you're going to experience from it. And it's very needed when we're dealing with these challenges. And that's where those mental breaks are necessary. So, and the physical breaks are just as important. So again, being in a different space, having the fresh air, being able to move your body, whether it's exercise or yoga or dance, any of those physical resets help our own regulation ability and should be also prioritized throughout the day. And the self-validation, often that can be missed, where you're validating the other person you're caring for, but what about yourself? It's important to acknowledge what you're doing, the commitment that you have, and the efforts that you're putting forward. So even if it's a bad moment in a day, it doesn't have to be a complete bad day, and still validating, hey, I'm trying the best, I'm doing what I can, and I know the next moment of my day is going to be better. I know that I can keep looking ahead and seeing what else can be done. So setting and managing, your own expectations, both with self of what, is reasonable to manage, and also what to manage with somebody else, becomes very important when we're looking at everything holistically and what's going to, optimize your ability to keep persevering. So just to kind of review everything in discussion around managing challenging behaviors is, again, that you're responsible for taking care of yourself as much as you're responsible for taking care of your loved one. Because as the saying goes, if we are completely depleted and exhausted ourselves, it makes it very difficult to provide the energy and care and support for somebody else, because there's only so much to give around. So we always have to make sure that we are getting replenished day to day, and acknowledging that when you're managing very difficult behaviors, it's exhausting. It can break people down. It can wear people down. It's something that can be talked about and should be, but also what do we do about it? And that's where those self-care routines and prioritizing that become very instrumental in managing and preventing such breakdowns from happening. And knowing that behavior and personality changes are so hard on the person that's experiencing them, because nobody signs up for these types of after effects following an injury. Nobody wants to be different or not have that composure and control over their emotions and behaviors. So it's also a process for the person dealing with it to adapt to these changes. And I think it becomes learning for both people how to respond, how to react, differently. But you as that care provider, the more that you're understanding it, the more that you can be consistent as possible, the more that it has the possibility of positively influencing somebody else. And importantly, is asking for help when needed, or in making sure that additional supports are put into place when needed. And that could be long term, but if it makes a difference of quality of life as well for you as being a caregiver, then it's very important to be looking at how that can be possible. And again, setting those healthy boundaries and expectations, both for yourself and for your loved one, is important to maintain that. And being mindful of your own behavior, your own body language and words and tone and all of that, and how that can influence and shape someone else's reactions or behavior, either positively or negatively. Focusing on one step at a time towards your goals of the day. So even though there could be a responsibility you have to yourself and to the person you're caring for, is making sure that you really modify depending on the day, depending on how you're feeling, in order to manage that. And trying to keep looking ahead, and knowing that there's always a brighter moment in a day, and there's always a brighter day ahead, and really trying to focus on some of those positives, like I said, even within the days that are the most challenging. And most importantly, focusing what is in your control, and of course what's not in your control. So I open it up now if there's any questions that you have, or any additional strategies, depending on your situation, that you would like to bring forward. I would be happy to offer any additional information or recommendations.